Well, welcome to another edition of Gunster's View from the Top. I'm George LeMieux. I have the privilege of being the chairman of the board of the Gunster Law Firm, and I'm here today with my friend, Secretary for the Agency for Healthcare Administration, Simone Marstiller. Welcome, Secretary.
Thank you so much, Senator. It's great to see you as always, and I am thrilled to be a guest on your program today. As you know, Gunster is always going to be near and dear to my heart, as are you.
Well, thank you so much. That means the world to me, and we thank you for your public service. I was reviewing your accomplishments. I mean, not only are you the Secretary for the Agency for Healthcare Administration, you've been the Secretary of the Department of Juvenile Justice, Secretary for the Department of Business and Professional Regulation, the Chief State Information Officer, Technology Officer, worked in the Attorney General's office, and have been an appellate court judge. You're like our John Quincy Adams of Florida. I think no one's had more experience and service in state government than you. So thank you so much for all you've done for us.
Well, it has been a blessing. And this is a career that found me. I could not have planned it any better. And I have gotten to do some really amazing things for the people of the state of Florida, which for me is the greatest blessing.
Well, we're blessed to have you. Let me get right to it and ask you some questions. Most Floridians probably don't know a lot about the Agency for Healthcare Administration. So tell us a little bit about what you do and what your vision is for the transforming the delivery of healthcare in Florida.
Well, the Agency for Healthcare Administration is the state's primary agency for health policy and healthcare administration. That's what the agency exists to do. We do that in two major ways. Number one, we manage the state's $35 billion Medicaid program. Right now, we insure nearly 5 million Floridians with that program. We're talking about a program that takes up nearly a third of the state's budget. That's a huge, huge task, as you can imagine. Medicaid is a state and federal partnership, and so we do have to work very closely with our federal partners to make sure that we are getting things funded, to make sure that our Medicaid subscribers are receiving the best health care that they possibly can get. On the other side of the house, we also do health quality assurance, which basically means that this agency regulates the health, safety, and welfare in the nearly 50,000 healthcare facilities in the state of Florida. So when we think of, facilities, we really are most people only think about hospitals, emergency departments, urgent care, those kinds of things. But we also regulate home health care agencies, facilities for individuals with developmental disabilities, obviously nursing homes, assisted living facilities, clinical labs, you name it. We oversee and license and regulate all of those facilities. And so, you ask kind of what my vision is for the agency and for healthcare in the state of Florida. What I'm trying to do is to advance Governor DeSantis's vision for healthcare in the state of Florida, which is to make it cost effective, to make it transparent, and to make it the highest quality that it possibly can be. And with those three objectives in front of us, everything we do, from operating Medicaid to doing health facility regulation, we put through those prisms. So we are working very hard to better integrate the silos that you've worked in government, silos, right? We're working to better integrate the silos that are both inside the agency and outside the agency to build a really strong healthcare delivery infrastructure from hospitals all the way down to primary care providers. That's what this agency really exists to do.
Well, I can't think of a better person to lead it, and especially at such a difficult time. I mean, here you are running the state's healthcare administration, which you said is 1/3 of the state budget, 50,000 providers, and then you have a pandemic, the worst health challenge that Florida or this country has faced in 100 years. How has the agency responded to the pandemic, and how is that going to change the way we deliver healthcare in our state?
Well, first, I mean, I want to take a moment to recognize the toll that COVID has taken on the lives of so many of our brothers and sisters across the state and in the country. It has taken a terrible toll. Families have experienced immense loss. And it really is the most difficult thing that you and I probably will see in our lifetimes, right? And COVID has taken a significant toll on our healthcare infrastructure. But I am proud to say that it may have bent us, and it may have been, we might have had some scary moments, but our healthcare infrastructure stood up to the challenge and did an amazing job. Our frontline healthcare workers, our doctors, nurses, folks working inside of our nursing homes in particular, man, the work that they did to keep people safe and to keep things running, nothing short of miraculous. Our agency, during all of that, we really served as the facilitator, right? So to do the best that we could to make sure that conversations we're having at a local and regional level. Everything, whether it's emergency preparedness or whatever it is, dealing with those kinds of things and responding is really at a local and a regional level. And one of the things that we learned, and of course we're going to take several lessons out of this, but one of the things we learned and we had to work on to help was to bridge those gaps between hospitals and nursing homes to make sure that individual patients had a place to go and things like that. It was helping hospitals communicate with each other, no question. I had numerous conversations with groups of hospital CEOs during the time. It was talking about staffing, right? We've all heard about how the healthcare staffing situation has been challenged, to say the least. People were working ridiculously long hours. Many people have left healthcare altogether. And so now, though, coming out of COVID-19, do we have challenges? Yes. But I am very excited at the possibilities, right? We now have a chance to truly transform healthcare in the state and transform the way it is delivered. And my agency, if I have anything to say about it, will be at the forefront of facilitating those conversations, bringing the right people to the table to talk about the kinds of things that we need to talk about. So, telehealth, that's going to play a much bigger role in the delivery of healthcare. What does that need to look like? How do our providers demonstrate that using telehealth is good and it's effective, and if not more effective, at least as effective as in-person visits. We've seen hospital at home, which is kind of taking hospital care, so post-acute care, and allowing people to recover from surgeries and things like that at home using technology. That is an amazing thing. We have at least 2 hospital systems in Florida who are pioneering that, and my agency has been very helpful in, helping to get the waivers and the things that they need to make those things happen. How are we going to recruit people back into healthcare? That means bringing the universities and the state colleges to the table to have those conversations. That means having the professional licensing boards at the table. I think ACA is in a very unique position to facilitate those kinds of conversations, and I'm really looking forward to seeing what can come out of that. So I think I'm surrounded by, both internally and externally, some very creative thinkers, very dedicated people, and we're going to do some amazing things for the people of the state of Florida moving forward, coming out of a very challenging time.
Now, I know you will, and if you think about how much we've accomplished as a state and as a country with, battling Corona, coming up with a vaccine, coming up with different therapeutic treatments. And you think back in time to other difficult challenges the United States had, whether it was fighting in World War II or the opportunities of the space program, those just created huge leaps forward for our country. And we hope, many of the things you mentioned, we hope that there's huge leaps forward here for healthcare. Let me ask you one question before we wrap things up while I have you, because I've been very proud of our governor and proud of you and our whole state government system of what you've done on prescription drugs and your efforts to try to think outside of the box to bring lower cost prescription drugs to the people of Florida. Can you give us an update about how that's going?
Absolutely, very happy to do so. So Governor DeSantis, as you know, a visionary. One of the first things he did when he came into office was to establish in statute for the agency to implement is a Canadian prescription drug importation program. As you probably know, Senator, way back in 2003, the US FDA was given the authority by Congress to establish some rules, promulgate some rules to facilitate importation of prescription drugs. Well, that law sat there and sat there and sat there until 2019, when Governor DeSantis went to DC and said, look, this law has been on the books forever. We need to do something about it. Finally, the FDA promulgated some rules. But under this governor's leadership, the state of Florida was the first state out of the gate to submit an importation plan to the FDA. And we're starting very small, if you will. So we're starting with a handful of agencies that will participate initially. The vision is to extend that to our Medicaid population. And then, you know, really candidly, the sky's the limit from there. I mean, we could add on state group insurance at some point. The big vision is for this to be something that enables all the citizens in the state of Florida to take advantage of these really great prices. And so we anticipate at this point that this program could save the state up to $150 million, at least. Moving forward, who knows? Fully implemented, who knows? But we've submitted our plan. And we're just waiting for the FDA to approve it. That's basically all we're waiting for. I hope that comes soon. We know that the Biden administration, President Biden himself, has said that he supports importation of Canadian prescription drugs. So one would think that there would be no reason why the FDA would not soon approve Florida's plan. And once we get that approval, we stand ready to begin importation in 90 days' time. I was so fortunate to be with the governor, I think it was back in May, during which he announced and showed the world the warehouse and facility that we have with the partner that we have contracted with. They are ready to go. We need to fill that warehouse now. But I am so excited to be part of the agency and the administration that is bringing this to the state of Florida, because it is going to be groundbreaking.
Well, that is super exciting. A lot of folks in government talk about doing things like that, but few accomplish them. So thank you for your great work on that. Thank you in general for all that you're doing for us. It's great to be with you. Thank you for being on Gunster's View from the Top. We're proud to call you an alumni of Gunster. Your many fine years of service with us, and we're just so proud of all you're doing for the people of Florida. So thank you.
Well, thank you very much. And again, it is my pleasure to see you and to be on your show. And you know, Senator, that anytime Gunster needs me, you have only to ask. So thank you so much.
Well, thank you so much, Secretary Marstiller. Thanks for being on Gunster's View from the Top.
Have a great day. Bye-bye.